Hey, this is Dr. Puya Devuti at Northeast Georgia Plastic Surgery, and we want to do surgery on you, but sometimes when you come here, there's things that kind of gives us a red flag and says, you may not be ready at this moment for surgery. So here's what we look for, because of safety is our number one thing. We look for your weight. That BMI, which is a body mass index, if it's too high, you're gonna have a higher complication rate during the surgery and after surgery. Your results are not going to be good, and you may have problems with wound healing. So we will make sure that your BMI is optimal for surgery, and every surgery has a different BMI criteria, and we like to keep it around 30 as a general rule, but you know, some surgeries we will accept a higher BMI because we know the results are going to be better if we operate on you earlier than if you try to lose weight. The second thing that we want to make sure that you have that would kind of give us a red flag is if your blood pressure is too high, that's not good. Problems happen during surgery, which includes bleeding. When the anesthesiologist puts you to sleep, your blood pressure drops. So if you're normally at a high blood pressure and your body is used to that, being put to sleep, dropping that pressure can cause problems. So we try to make sure that your pressure is pretty much well controlled before the procedure and is not too high. The third thing that I think that's kind of important is you cannot be smoking. No nicotine products in your body. No patches, no gums, no vapes, none of that. Nicotine makes blood vessels small. When blood vessels are small, it leads to wounds forming. So when someone comes here and they have nicotine in their body, whether it's primary, whether they're smoking it, or their spouse or their friends smoke it around them, and they're getting that secondhand smoke, which is just like the first-hand smoke, that is going to cause a wound complication. So as a general rule, that's a hard no. If you're using nicotine products, be prepared to stop. And we require you to be stopped 4 weeks prior to the surgery and 4 weeks after the surgery. So at Northeast Georgia Plastic Surgery, come and see us, and we will make sure that you are optimized for that surgery as best as we can.